Dengue fever is a disease caused by a virus carried by mosquitoes.
The characteristic thing about it is you get a rash, severe pain, high fever, and in a small number of cases you get what I call hemorrhagic dengue, where you have serious bleeding which can be into the brain and various other organs. And this is the one that tends to be a killer.
Symptoms can start anywhere from 4 days to 2 weeks after being bitten by an infected mosquito and typically lasts for 2 to 7 days. There is no specific treatment available for dengue fever. Mild cases are managed with lots of fluids to prevent dehydration and getting plenty of rest. Pain relievers can ease the headaches and pain associated with dengue fever. However, vaccines are now being tested for dengue.
And they're now working on a vaccine, various companies are working on vaccines, which have had a positive impact as far as reducing the number of cases. But if you get it after the vaccine, the risk of getting hemorrhagic dengue is greater.
Meanwhile, the only way to prevent dengue is to avoid being bitten by mosquitoes.
Making sure that there's no breeding spots, pouring oil onto any stagnant water, using mosquito nets, putting nets around the house, putting mesh around the house, and sometimes using insect repellents, rubbing it on the skin. And sometimes they said wearing dark clothing tends to attract them.
Some pain relievers, such as aspirin, should also be avoided, as this can make bleeding more likely. With your health report, I'm Shamala Mitchell wishing you good health.